A very good evening all. I am Aditi Lamba with the Wednesday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 115 million cases of COVID-19 with more than 2.5 million deaths. Here in the United States, we are at more than 516,000 COVID-19 deaths with nearly 29 million cases. States Texas and Mississippi have lifted COVID-19 restrictions, including ending mask mandates. These orders come from the governors of the state, where they are also allowing businesses to operate at full capacity. Experts worry that loosening restrictions right now could lead to devastating results, especially with several variants of the virus circulating across the nation. In politics, Senate Majority Leader Chuck Schumer said that the Senate will move to take up the $1.9 trillion coronavirus package as early as tonight. This comes as the House has passed the package, which includes $1,400 direct checks for Americans making less than $75,000 and extends federal unemployment benefits. On this, do you believe that $1.9 trillion package should be passed? Send us your comments on events@itvgold.com. With that, tonight we cover lots on coronavirus updates and measures. Here are the headlines. Dr. Lisa Teng on coronavirus updates and measures, Chief Medical Officer, Hackensack University Medical Center. Dr. Tushar Patel addresses COVID-19 vaccines and variants, New Jersey. Dr. Syra Hanif urges all to stay vigilant against coronavirus, New York. Time for a short break. With us on Vision of Asia South Asian News segment. We'll be right back. Welcome back. I am Aditi Lamba and this is Vision of Asia Wednesday night episode of South Asian News. Let's take a look at coronavirus updates and measures. Federal health officials are calling on states Texas and Mississippi to keep wearing masks as governors there lifted COVID-19 restrictions. The officials said that it is premature to abandon mitigation efforts that have worked to curb the spread of the virus and warned that the virus can erupt again, even when there is a decline in cases and deaths in the country. The CDC Director, Dr. Rachel Walensky, has said that it is not yet time to lift restrictions and said that she was really worried about the impact of COVID-19 variants and the loosening of restrictions in some states. This is happening while the efforts to ramp up vaccination program continues, with now the Johnson & Johnson single-dose vaccine being administered alongside Pfizer and Moderna. On this and much more, we spoke with expert Dr. Tushar Patel, who reflected much on masks, vaccines, and variants. Here is Dr. Patel. States Texas and Mississippi have lifted their COVID-19 restrictions, which includes ending mask mandates as well as giving their businesses 100% capacity and allowing the businesses to open up again. My question to you is this wise? Should this be done right now? How are you looking at it as a medical expert?
So let's go back March 2020, we had less than 50 deaths and less than 1,000 cases in March 2020. We are at 500,000 cases, 500,000 deaths now. Texas and Mississippi removing the mask mandates, reopening the business at 100% is definitely against the CDC director's recommendation. CDC director warned state officials against lifting those public health restrictions. And I think this will be a huge impact on not only on the state, Texas and Mississippi, but across the nation.
Right. What's the worst case scenario?
With various variants spreading all over the states, we will lose the hand we had ground to gain control of this virus. We will lose the momentum. We will lose that grip on controlling the pandemic. And I think we can go back into circle again where we have more cases seen very soon.
Yeah, let's talk about these variants a bit, doctor. You know, today I'm looking at more than 28 million cases and at least 516,000 deaths in this nation. They are saying the trajectory is going down, but is this variant worrying you? There is the UK variant, Brazil variant, as well as the South African variant. What can you tell us about it?
So variants seem to spread more easily and quickly, which lead to more cases, increasing number of cases, which put more strain on the healthcare system in the US. which can lead to more hospitalization and potentially more deaths. So definitely those variants are troublesome. I want to give you one number right here. Last 7 days only, we had more than 460,000 new cases in this country. And so that means 60,000 cases every single day. Average is 46,000 people are in the hospital, more than 40,000 in the hospital every single day, and 14,000 deaths in last 7 days. So we are not off the hook yet. We have to take all the precautions we can to fight this pandemic.
Right. With these two states opening up and also with what the variants are doing, Doctor, what's your prediction for the next 2 months?
So the original predictions was to have 600,000 deaths by April. The way it is going, we will see those numbers. And I think that is very sad scenario for us. If all the states doing the same as per the CDC and public health recommendations, we definitely can beat this with this vaccine on horizon right now.
Right. Let's now talk about the vaccines, Doctor, because I have a lot of questions. The biggest one in the news is Johnson & Johnson's single-dose vaccine, which has been approved and is being administered right now. It is 66% effective against moderate to severe disease and 85% effective in most severe cases. People are a little hesitant about the efficacy of this vaccine. How are you looking at it, and what can you tell people about it?
So let me tell you, Johnson & Johnson vaccination is one-dose vaccine, which is 72% effective with one dose. Okay, it is very, very good vaccine, 85% effective against the severe disease and hospitalization, 100% effective at preventing death. So the ultimate goal is to prevent the death. In the viral disease, you need to prevent the death, and Johnson & Johnson vaccine is ready to do that. So my message to all the people who are getting the vaccine or who are ready to get the vaccine should take the vaccine whichever is available to them without any concern.
Right. Dr. Patel, they had to do, Johnson & Johnson did a large trial, which was later in the pandemic. Do you think that's why the efficacy is low, because now they are dealing with these variants, which we didn't see last year?
So Johnson & Johnson was tested after some of the new variants happened in South Africa, which proven to be effective against those variants. So in my opinion, my medical expertise, I would say Johnson & Johnson vaccine will be much more effective against those South African variants for sure. And I'm pretty sure they will be effective against the UK variant as well.
And Johnson & Johnson is starting to study a 2-dose regimen, Doctor, where they want to add booster shots. Do you think that's a wise decision on their part? And I keep on hearing the word booster shots even for Pfizer and Moderna. Can you explain to us what exactly they mean by that?
Yes. So right now, since this is only a 1-year-old virus, we don't know how this virus will react in upcoming years. Just like flu vaccine, we take it every single year. So this vaccine, COVID-19 vaccine, we may need to take it as a booster. As of right now, it's too early to say, but the way it is going, we may need some booster for all 3 vaccines.
Wow. Now let's take a look at Moderna and Pfizer, Doctor. My question to you is, we keep on hearing about mixing the 2 vaccines, in order to speed up the process of giving vaccination, the 2 doses to people. Do you think it's wise to mix the 2 doses? How are you looking at it?
I would not recommend mixing the doses. If you take the Moderna vaccine, if you take the Pfizer vaccine, or if you take the J&J vaccine, you have to just take that vaccine only. There is no reason because that efficacy and safety has not been proven. So if you mix match those vaccinations, it's not going to help and it's not going to be effective.
More on coronavirus updates and measures. President Joe Biden has said that the United States is on track to have enough supply of COVID-19 vaccines for every adult in America by the end of the month of May. The president wants to accelerate the vaccine efforts to get us out of the worst public health crisis in a century. The Biden administration is providing support to Johnson & Johnson that would enable the company to produce vaccines faster. Meanwhile, today the White House said that U.S. states need to rally together to maintain safety measures like social distancing and mask wearing, even as the federal government helps ramp up the production and delivery of vaccines. More on this and the need to stay vigilant right now, we spoke with Dr. Syra Hanif. Here is Dr. Hanif. My first question to you actually looks at some numbers that are coming in today. Today, we are at 115 million coronavirus cases with at least 2.5 million deaths. That's in the world. In the United States, we're at 28.7 million cases with at least 516,000 deaths. These numbers are quite large, but we keep on hearing that the trend is going downwards of the cases and the deaths. Is that actually happening?
So the trend in terms of patients getting really sick in ICU and the death rates, that's lower. But patients are still there are still people getting getting positive for COVID-19 because again there's so many new variants now which are more infective, and the number of cases are still high. So the mortality rate is less, but the number of cases for COVID-19 are still going higher.
Right. Let's talk about this. Experts are saying that there may be a fourth surge due to these variants that you just had mentioned. What is your comment on it? And if you could describe to us what this UK variant is doing and the South African variant is doing, it seems like they're circulating the most.
Yeah, so it's just that more research is going on. There are more studies going on, and these variants were already there. Like with every virus, there are always variants. Because the virus mutates and then there are going to be new variants. We know some of them now, but in future we'll find out about even more variants. But that's how the virus basically tries to survive. These variants, again, so many different variants. The UK variant, it's more infective, but again, we've seen that the mortality is not that high. It causes mild symptoms, but again, it infects so many people because it's more contagious. So that's why we're seeing more cases. And I think in US, like we have seen more UK variant as compared to the other ones. So in terms of prevention, what we've been seeing since the beginning, wearing your mask, social distancing, washing hands, and just doing all the precautions, we still have to do that because otherwise the virus will keep spreading even with the vaccines which are out. There are so many people who still don't have the vaccine. Right. And again, the vaccines still don't prevent you from getting COVID again because all these new variants are coming out.
Right, and some of these vaccines are not even effective against this virus. When you're looking at this trend, doctor, what is going to happen in the next couple of months while you're seeing these variants come in? What's your prediction?
So with all these new variants coming, and I think with more research and more studies, we're finding out more about them. The vaccine definitely is going to provide some kind of protection. But again, it's not effective against all the variants. So the precautions still have to be there. So everyone should just, I think the vaccine just provides that satisfaction that you can just go about your day, like routine life, which we had a year ago. So it's not the case. You still have to do the social distancing, mask, and everything else. Even if you've gotten the vaccine. And right now, actually, we're having a problem getting everyone vaccinated.
Right.
So we're still in that phase.
You know, before I ask you more questions on the vaccine, because I have a ton of them, when you're looking at the current cases, doctor, experts are also saying that ages 20 to 46 might be responsible for these ongoing cases that we're seeing. What are your comments on that?
So again, that the younger population, less comorbid conditions for this age group as compared to older age group who are still practicing the social distancing and all the precautions, because again, if they get COVID-19, their chance of getting more sick and ending up in the hospital is more as compared to younger. But again, this virus can affect any age group, and you never know which way it's going to go. So the precautions still would be there. This age group, I think with all the relaxation in opening the restaurants, travel and all that, since they're doing all this, they are getting like more cases in this age. We're going to see more. But again, there's nothing much which can be done other than just telling them, try to do the social distancing, masks, and whatever we were doing a year ago. I know there's COVID fatigue and everyone wants to travel now, go back to the restaurants, eat out, and socialize. But we have to be really, really cautious because everyone is not vaccinated right now.
Yeah.
So we haven't reached a herd immunity yet. And again, the way this virus is going, how the studies are going, we don't know what's ahead in future. So we need to be cautious at this point.
Yeah, the sense of normalcy that everybody, wants, we're not there yet. I think it's important for everybody to know that. Doctor, let's talk about the vaccines right now. My first question has to deal with Moderna and Pfizer, which have been given in the country so far. Have you seen any differences in side effects from these two vaccines? And do you recommend one over the other?
Mm-hmm. So both the vaccines, no, I wouldn't recommend one over the other. In terms of efficacy, they're both equally good. They're providing almost like 95, 96% efficacy. Side effect profile as well, almost similar. And again, every person will get different side effects. Some might not get any. So fever or myalgias, fatigue, these symptoms, side effects which we see with both the vaccines. And again, the degree varies with different people.
It's time for the show break on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Aditi Lama, and this is Vision of Asia, South Asian News segment. More on coronavirus pandemic and its impact. Today, the White House said that President Joe Biden hopes that Americans would continue to follow guidelines such as mask wearing, even as some states, including Texas, lift their restriction amid the ongoing pandemic. Biden administration officials have sought to push back against the lifting of restrictions, warning that now is not the time to stop being vigilant. This is happening while the country has more than 2,500 cases of coronavirus variants that can spread more easily. So again, please keep following the 3 CDC guidelines. On vaccine, more than 102 million vaccines have been administered and distributed in the US, and about 78 million have been administered, with now Johnson & Johnson's single-dose coronavirus vaccine added to the list of approved vaccines to be given to Americans, hoping to be a game changer. So what should we do while we wait to be vaccinated? We have now our conversation with Dr. Lisa Tang. Just talking about Johnson & Johnson, I was just getting there. It has 66% efficacy against moderate to severe and 85% efficacy in most severe diseases. This vaccine has been called a game changer because as of today, it has been authorized for use. It's going to be administered this week. Is there going to be a huge difference in immunity between Moderna, Pfizer, and Johnson & Johnson? Some people are worried about taking Johnson & Johnson because of the efficacy. What do you say to that?
So my request to everybody is take the vaccine, irrespective of which one you take. The efficacy is always better than zero, right? If we take the flu shots, the flu vaccine efficacy is in that lower 50 to 60%, depending on the variant. But the most important thing is getting any of the vaccines. And remember that J&J does have a higher efficacy when it is moderate to severe disease and also for the hospitalized patients. So you can't go wrong. And I think it's a way to pay forward to create that herd immunity.
And J&J is studying a 2-dose regimen right now, doctor. Why do you think they're doing so? Is it because they want to produce booster shots for these variants?
I think most of the second shots are meant to be booster shots. I think the data and the science behind it will tell us why they are trending towards that. But so far, they have shown that the single shot can have the same efficacy as the dual shots, especially for the hospitalized patient, though it's in the 85%, but that's pretty impressive.
Right. Let's talk about Astrazeneca, doctor. The vaccine has been approved by the World Health Organization, but was stopped by South Africa due to the South African variant. It has not been approved in the United States yet. How are you looking at Astrazeneca? Do you have any insight into it?
Not much insight, except what the CDC has commented on it. I think AstraZeneca has some advantages on the storage and ability to be able to be given in areas maybe where there is less ability and access or storage facilities. So that's where AstraZeneca has really been efficacious globally.
What do you think is currently missing in the vaccine research, doctor?
I think it's the research piece that needs to continue and data over the next year to 2 years to show us how these vaccines create herd immunity and individual immunity, and how long do they last, and what is going to be the various different efficacies as we go through this journey of COVID. COVID is here to stay. Yeah. It is the new norm. I think data and science is going to be critical, and I'm excited that we have the research and the data and the science coming along, as we all know that these studies are continuing as we speak.
For sure. I have more questions on vaccine, doctors. We are hearing that the immunity currently lasts about up to 90 days. In some papers, we have read that. What do you have to say about that? How long is this immunity actually going to last?
I think, again, this is ongoing evidence and ongoing, it's always a fluid situation. I think 90 days is a safe number that we bank our hats on, that your likelihood of getting infections within that 90 days is less. And that is in respect if you continue to do follow the rest of the guidelines. So that's the reason why it is 90 days, either post-COVID infection or a post-vaccination.
And, doctor, once you're vaccinated, for a lot of the population that has been vaccinated, what can they do after being vaccinated? Can grandparents visit their grandchildren? How much do you have to mask up? How are you looking at that?
So I think the most dangerous pitfall is false security. Just because you've got the vaccination doesn't prevent you from getting the infection. As we say, efficacy is 95%. But there is that chance. So I think it's very important to be responsible in a sense that if you are visiting family that has comorbid conditions or are prone to get sick, you have to be extra careful. You have to make sure you wear your masks. And as we know, CDC also has new guidelines of double masking, but making sure you wash your hands, you keep your physical distance. And I think that cannot replace any of science or the vaccinations, right? I mean, these are the things that have been trusted, proven, and retested, and we know that that does work.
Right. Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organization on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.